Well, if you suffer from frequent or even chronic back pain, there can be relief. The experts at Tulsa Pain Consultants have different types of treatment available for all types of pain, and they can find the right one for you. We welcome Dr. Andrew Revelis of Tulsa Pain Consultants and our very own head pain, Pat Baldwin. Thank you for joining us this morning. Pat is our GM here at Tulsa's Channel 8 and also a patient.
Right.
Thank you for joining us. All right, so you were telling me one of the things that really stuck out to me is you guys are all medical doctors. So this is something you guys know very well.
Yeah, it's a medical way of managing chronic pain and all sorts of different kinds of pain. What we like to emphasize is it's an effective, non-surgical, cost-effective way of managing pain symptoms to keep people going and keep them away from surgery many times. And Pat will attest to that.
Yes, Pat, you've actually had a few procedures.
Right. And my deal was to stay as active as I could and go as long as I could without having to have surgery. And so my lower back, I've not had surgery yet because of the procedure I've had. And I will say, they always tell you it takes about 3 days. For me, it's about 3 hours. 3 hours, I feel the results. That on my neck, it was just keeping that surgery away as long as possible. And so I was able to do that. So it worked out great for me.
And you guys might not know Pat very well, but he's an extremely active guy, always in the gym, always moving and grooving. And you said the downtime on these procedures is really insignificant.
It's very minimal. And Pat is the perfect example of the kind of person we see many times as somebody who wants to be better, but somebody that can't afford to be down with a major surgery. And many times we can help quite a bit with these types of symptoms. Now, Pat is not the only kind of patient we see. Many times we have an older population of patients that may not be in the best health to have a surgery, and we can many times manage their pain symptoms with these non-surgical techniques because they're too sick to have a major surgery. So we see both ends of the spectrum and can help people in all sorts of different ways.
Now, with both of you, we've talked about the effectiveness of time, but also these procedures are very cost effective as well. Tell us about that.
Well, yeah, I mean, having a major surgery, aside from the time you would be out of work, it's a very expensive undertaking, and for us, it's a very minimal cost for the amount of improvement you get. I always tell folks it's a great bang for your buck. It will help, but it's a very minimal cost. It's all covered by insurance, and so this is not experimental. It's not anything that's very exotic. It's all covered by insurance, and it's been medically accepted for decades and decades. So it's nothing that is any different than any other medical treatment you would go to a physician for.
And Pat, when did you decide that this would be an effective treatment for you?
Oh gosh, I think I went probably 7 years ago. And it's great when you go there because the staff is very friendly. You get in there really quick and you see a doctor really quick. So you see the doctor, they relax you, and then you go in the room, have the procedure, and it takes all of probably 5-10 minutes. Then you go back, they sit you down and get you something to drink, and they watch you for a few minutes to make sure you're okay, and then you're gone. I mean, probably 30 minutes for the whole thing.
Yeah.
Wow.
Well, and like Pat said, you know, it is helpful. We work with your primary care physician, so a lot of times if patients are hurting, they can call us directly. We will get records from your regular family doctor. You're not doing anything that runs opposite of what your family doctor would want to do. We work hand in hand with your family doctor so that we can take a team approach at managing this, much like we have with Pat, and you get tremendous results.
And my doctor obviously referred me to Andy, and so, you know, for this time period, I've been seeing him off and on, you know, for 7 or 8 years now.
Well, and it is good to have a team working with you,
sure,
your primary care,
right,
and then you guys, and then whatever other steps that you need to take, and they're all doctors working together.
That's right.
Yes.
All right, well, thank you both for coming on the show. We appreciate it.
Thanks for having us.
We want to tell you guys more about the Tulsa Pain Consultants. They're there at 2000 South Wheeling at Suite 600. You can give them a call at 855-918-PAIN or look them up online, tulsapain.com.